Live.
Hi everyone, good evening. Oh, you're back with us. So we have filler night tonight and I have some of my really beautiful patients coming in to see me. We're just doing a little touch up. We've done a few treatments along the way, so we don't need to do anything super dramatic, just a little bit of elevation and definition to the cheekbones. We're going to do a little bit filler to our patient's lips today, which is really exciting because previously we had done a little bit of Botox for a lip flip. So we wanted to see what the lip flip achieved, and it actually made it so she had a lot less of like a gummy smile when she smiled for photos. And now we're going to volumize, so that's great. And we're just gonna get started. She loved the lateral cheek that we did last time, so I'll give her a little bit of mid-face support through the apple of her cheek and just extend back a little bit.
Can I show them something really quick?
Sure.
So you guys, when you have very thin patients and they're a little bit longer in face, the typical thing for someone that's athletic is that the middle face starts to drop and become a little more hollow and dark in the under part of the eye. So for her, she has a nice elevation, good jawline, but she's flatter here. So what Danielle's trying to do is to give her a little bit of lift so she'll have that contour, the chiseling, and the improvement of the under eye without looking overdone. And to do that, we don't use fillers to plump up, we use the fillers to give a little bit of lift, to give some structure and some definition. So that will give her a really nice shaping. Now the lips is the cherry on top, that's the fun part. But here you can see, Danielle, tell them about your technique and what product you're using and why.
So for the cheeks, I really like Voluma. It's a longer lasting product, has a lot of good lifting power, and it's not going to swell the way a lot of others do. So this is great for building up structure for areas where you want to mimic bone, whether it's to add the definition or to replace things that have the volume of bone that has diminished over time with aging. So it's great for patients younger and older. One more foot down here. Technique-wise, I like needle and working on bone for this.
And the thing to notice, you guys, is Danielle just did some lateral cheek elevation on the bone, and if you draw a line here like this, there's a line that we can draw here to give enhancement like this, like women would like, and then there's a line that we want to draw across here with the fat pad elevation that we want to help the under eye.
Yeah.
So right now she's working to give definition laterally, and that's done with deep injections on bone or in the subcutaneous superficial space. And then here, I don't know, you're going to go more midline too or no?
A little bit more midline right now. We had done some under eye filler last time that I saw our patient.
And it improved.
And it certainly improved.
So you want to make sure a
lateral
noticeable
today.
sign of having filler done is if all of it's done laterally and nothing is done in the midline. So we really want to make sure that you're using the filler to blend, and when you do that, temple, cheek, under eye, that's called the OG curve. And you guys, it's not original gangster, okay? It's OGEE. Okay, it is a specific term and it's special for fillers, but in general, that's the more beautiful transition of the cheek, upper face, under eye region, and that's what you want to look for in balancing and in harmony. And that's good. She also is having her move so she can follow the fat pads and make a more natural, subtle improvement.
One more smile again. Good, and relax.
But Danielle can call herself the OG. The OG injector.
Yeah.
How's the pain? You're not even flinching.
No, it's not bad at all.
Oh my god. I mean, Danielle's really well trained. Anyone say anything? How long before the swelling injection sites go down? So Danielle, someone wants to know how long before all the swelling goes down?
Okay, it depends on the patient, it depends on the treatment area, and it depends on the product used. So there's a lot of factors, and also, you know, what did the person do prior to being seen and what did they do after? So we actually contributed to a magazine article on this the other day, and when it comes to areas of the face, we'll start your lips soon, but to answer your question fully, different areas of the face swell differently. Cheeks, not so much. Lips, absolutely. So with the lips, even just a bump on the lip, for anyone who's ever dropped their phone on their face, a bump on the lip is going to make your lips swell, let alone a needle poke. So if you're using something like an old school Juvederm, great product for the lips, but you're going to get that very much duck pout for a good 2-3 days. with things like Velour, Volbella, or even Voluma, they do not attract as much water, so swelling doesn't stay as prominent. Icing after is very helpful. Arnica is very helpful. And yeah, about 2-3 days for it to really settle down and for the majority of it, but it's pretty quick, and icing helps tremendously. Okay, so let's start on the lips here. So we want to go for a little bit bigger of a pout on the bottom, and then elongating a touch on top, and then filling in the central volume, right? Okay. So for lips, lately I really love a pillar technique. You like to do this as well. It gives you some elevation to the lip, but also allows you to control volume. So it's a lot of little pokes, first one. Little pokes.
This technique originated out of Eastern Europe many years ago. A lot of the Russian patients really like to have a little more voluptuous and more upturned lip, and what was found was instead of injecting horizontally into the lip and causing the lip to move forward, if you injected vertically into the lip would flip upward and give a little bit of a eversion much more naturally, because you lose volume behind the lip and around the mouth as you age. So the mouth and the chin cave in. That's why early on when people come to see me, we talk about chin augmentation, we talk about improvement of volume around the mouth and not just the lip itself, so that it looks more natural. If someone just gets their lip done and they don't do anything else and they have folds in chin that's recessed, it looks very overdone and ducky. You didn't tell me that they're saying they love me.
What about me?
That was nice. They're waving at you and doing thumbs up. They're doing thumbs up.
Look at me.
Do you aspirate?
She actually did aspirate if you watched. I do not, because I've done this for
I
a
do
very
and
long
I
time.
don't. I do and I don't. I was not really taught to aspirate. I know it is kind of good practice. We like to do it. I definitely have aspirated and had blood drawn into the hub, and it's freaky. You want to know that you're being safe, and of course knowing anatomy is super important. But you know, there's certain areas where I do religiously and there's certain areas that I don't. There's not always a rhyme or reason to it. In the areas I'm more concerned about blood vessels, then absolutely. But sometimes yes, sometimes no. That's the truth.
Do you use cannula? And what's the difference between needles and cannula?
Yes, I use cannula. I've come to really love them, even though I was a pretty avid needle injector since the beginning of time. Needles are more precise because they are sharp, they're rigid, so where you put that needle is where the product is going to go. But with a cannula, the really nice thing about it is you have fewer pokes and you can really get to a wide range of treatment area. So I do like that, and also you're less likely to have bruising, it's more comfortable for the patient. It's a blunt tip, flexible, kind of elongated needle.
Remember, with cannulas, that's more for, we're blocking the camera. With cannulas, it's more for large volume filling. It's a little bit harder to get that precise, meticulous injection technique. So lips, which I was one of the first to do cannulas like all the time in the lips, and now I actually don't do them nearly as much because you can't get as much definition. It's a little bit harder, but it's great for the mid-face, for chin, for large areas like jawline and stuff.
Will there be post-op bruising, and is there anything you could do to prevent it or limit?
Anytime there's needles, there's a potential of bruising, and prevention is going to be icing and arnica and red light, okay? So, you know, lips always have a lot of blood vessels, so there's a little bit more risk.
I really urge my patients to ice 20 minutes on, 20 minutes off immediately after injection. Even on myself after a laser, when I've noticed a lot of swelling, I did 20 minutes of icing plus red light, and it made a huge difference.
You guys, nobody cares nowadays. Everybody gets this stuff done. Go shop on Rodeo. They're gonna ask you what doctor you go to, okay? That nobody cares if you're a little bit swollen. Just say you went to a picnic and you got stung by a bee. I don't know. But it's okay nowadays to have a little bit of swelling. The key is to limit the swelling as much as possible so nothing happens with the filler. There's no alteration of that. And that's by doing the arnica and the icing and the red light and just taking it easy. I had patients this week that went right to the gym. They're gonna swell much more if they do.
Are
Maybe take a day or two off.
Are they dissolvable? Like, what if you don't like the results? Can you?
Yes, these are dissolvable fillers. They're hyaluronic acid based, and hyaluronic acid is found naturally in your body, in your joints.
Now this is Juvederm volvella. This is one of the softer, silky fillers. This is easier to reverse in some instances in areas of movement, sometimes a little bit harder under the eye, but in general it's very soft and silky and can be injected really superficially.
Almost done.
Now, since it's training night, I'm going to do something special for our patient here today. I'm going to do filler roulette. So she has to spin the wheel right now and see if she trusts
Wait, we have a wheel?
that I want to give her 2 more syringes of filler in a couple locations in her face. But she has to decide, does she actually want to do that or not? Would you trust me if I said I wanted to do a little more filler in a couple places, and I'll tell you where once you say yes or no.
You're live. You're live. Okay, yes.
Okay. Perfect. Okay, so
Tough question.
So here's the thing, you guys. Look at her face. It's very beautiful. It's very, very elongated, chiseled, very Sandra Bullock look. She has a really tight jawline. However, she has a little bit of hollowing in the temple because now her cheek is very defined. Remember that OGE curve is not as balanced. And if you look from the side, she has a beautiful nose, really straight. It's just a little longer, and her chin does not match now with the proportion of her nose to lip to chin. So we're going to use a syringe of filler for a temple, we're going to use one for the chin, and that's going to do overall harmonization. So why don't you grab, I'll do half, you do half. I'll show you guys, this is really easy, it's almost no pain at all. And the thing is, we're not going to use a lot, we're just going to use some standard Juvederm, which will hold a little bit of water and give a little substance here.
Let me wipe. And also, you gotta be gentle. She wasn't numb there.
I know, and
We didn't know roulette was coming.
The whole point of not numbing there is I want you guys to see it's not that painful. It's
I trust
literally.
you. She's
I
like,
know,
okay,
trust
we'll
me.
find out.
We're gonna one pinch, okay? We're gonna go really slow all the way down. The only thing that's really kind of annoying about this treatment is the sound it sometimes makes. In some people, there's a little bit of crackling or some noise as we're on the bone. But this is a really safe area, and the thing about it is it's really going to balance her lateral cheek and her brow. So we're just going to do one insertion point. She really doesn't need more than that because I want to give it in a location. We could actually do a second one. I'll show you really quick. We can actually do right a little bit higher, one little spot right up here where her brow is, just to get a little bit more elevation in the brow. And this will give her more than a Botox lift, but it will balance perfect. So now I'm going to give that to Danielle. So I'm going to show you guys there. Look, if you take a look at one side versus the other, she now has some filling in the temple with only half a syringe and a little lift in the brow. And that's balancing now with her cheek. So same thing, so filler roulette tonight. It's going to throw in a few extra things if you trust. So in this area, we're going below all the blood vessels and nerves, but you obviously have to go through them, so it's very important. You take a really slow injection technique, use a small needle. Some people use an infrared scanner and actually look at the veins. We've done this for a long time. I actually had my finger on her artery. I could feel it pulsing right here. She was very nervous. So, you know, that artery, I was a skin cancer surgeon. That artery comes up through here, so I had my finger right on it, which compresses the veins so that there's really not a lot of risk of bruising. It's very minimal. The negative to this is that when she chews tomorrow morning and goes to eat, she'll be like, oh, I have a little bit of pain there. And she didn't realize why she had that. Oh, then she'll remember, Dr. Emer forced her to do the filler into the temple. But it'll make a nice difference. And it's a subtle thing that you don't really notice, but subliminally it just makes her look better. And you'll see now, look at the filling out of that. Looks great, half a syringe, nothing crazy. Perfect.
Now, when you were talking about the filler dissolving, how long does it take to dissolve?
The dissolving takes up to 72 hours. Some instances it can be actually immediate, but up to 72 hours is what I tell people. And you can do an injection every 72 hours if needed. Now, let's balance her chin. Now here's the thing, we want to draw a line from here to her lip, and then from here a little bit of an angle there. This is where we want her projection to be. You don't want to widen it here, because she has a very narrow elevation in her cheek. So we're going to do, I'm going to start, look up just a teeny bit. You're going to feel a little pinch. I know you didn't numb a lot. not the best feeling, but it's not too bad. So we're just gonna do a very small amount in the center. Let's get some projection. This is really where she's gonna notice it the most.
Can you do fillers on the forehead?
You can, it's a little higher risk. I like to do it actually for the fine lines there, or for the deep furrows that guys have. Okay, so we're gonna do one there. We're gonna do one laterally, a little bit, same area, right on the chin. It's like injecting an implant right into the muscle, right into the bone. Just a small amount.
Now, what are you injecting again?
We're injecting Juvederm. Okay, turn that to me just a little bit. See, now this is built out. So we're gonna go right over here. Same thing, little pinch.
More people are saying they love you.
Thank you. And Danielle.
Yeah, hey guys.
We have to say, hey guys.
Hey guys,
There
it's
you go.
Danielle. We're in the OR today.
Yes, perfect. Sorry. A couple pokes. And then I'm gonna leave this little bit now to Danielle. And this is what we should do. So here, Danielle, take, unless you want me to finish, it's up to you. But I think what we should do now is right here, we now have the projection. If you turn to the side, take a look. Nose, lip to chin. Now fully balanced if we draw a line. See, like this. Perfectly straight. You can touch the chin to her lip elevation to her nose. Now right here, there's a little loss of volume. This will support her lip and support her chin. So Danielle will use that third of a syringe to balance out this area.
We love you, Danielle.
Guys.
This is gonna make a huge difference for her.
What's best for chin, Juvederm or Sculptra?
Well, Sculptra will build over time, but it's not gonna give a nice structure to her chin. I like fillers there. For her, this is the first time, is this the first time doing her chin?
Mhm.
First time doing a chin, you wanna do something soft and subtle. Eventually, if you feel a chiseling is needed, I think she's a smooth, more subtle look. I like a softer look to the area, so the Juvederm gives just a nice subtle look without it looking overdone. Do a little right on here, right there. We have enough. Do like one poke and one poke. We're gonna do a little on the both sides right there, sort of marionette / support of the, what I call the lower cutaneous lip. This is an area a lot of people lose volume as they age, or if they're very, very thin, they just lose volume. So, now, the question was, do you trust? Let's see what she thinks.
suspenseful.
It's like a movie, it's like a Saw movie.
Okay.
You choose the room that you go into.
Oh, I can't believe I just did that.
I know, take a look though. What do you think? Take a look.
Oh yeah,
What do you think?
it's very subtle. I like it.
And you see how this is filled out a little bit, and then if you turn to the side, you see how you already have a nice jawline, but now it's projected and there's a line. If we draw it down, it's even, and I know it doesn't seem like it's a big deal, but when people look at people, subliminal beauty, it's one of those things that they don't notice, they don't know why you look better, but it balances now everything. Those two things.
Yeah, it looks like everything kind of blends more together, right?
Perfect. That's what we want.
That's, yeah.
So that's female facial
Alright,
shaping, you
trust
guys. You did
I'm
great.
glad I trusted you. Thank
One
you.
girl
She
really.
won. Look at that.
And I feel like I just won the wheel.
2
Slot
syringes.
machine.
Okay, well that's it. We'll go on to the next.
Give it back to me. You're so on.
Perfect. So now we'll just take the after photo. Oh no, she needs to do a Botox. Take the